Good morning, everyone. It's my pleasure this morning to introduce a friend and colleague, Dr. Astrid Pujari. Dr. Pujari did her medical school at Tufts University and then went to the other coast, to La Jolla, to Scripps, and did her internal medicine, and then decided the traveling wasn't enough, so she went to the College of Biotherapy in England for a year and got a degree there as well. And Astrid runs our integrative medicine program here at Virginia Mason, and I'm going to introduce a new term today. Astrid is also a cafe colleague of mine, meaning we have shared multiple meals together. And if you folks don't know what I mean by the cafe program and our physicians or APP, please let me know, because it's deepened our friendship as well. So go ahead, Astrid. Thank you for talking today.
Hello, thank you so much for being here today. It's such a pleasure. So as you know, today we're going to be discussing whether plastics and pesticides are contributing to obesity. So we all know that obesity contributes to cardiovascular disease, hypertension, diabetes, stroke, fatty liver. But what we may not remember is that obesity also contributes to a number of cancers, and not just hormonally related cancers, like endometrial, breast, and colon, but also pancreatic cancer, gallbladder cancer, meningioma, multiple myeloma. Obesity prevalence, according to the World Health Organization, has tripled worldwide, and obesity prevalence in US adults now is at about 40%. In addition, the CDC has stated that 1 in 5 children now are medically considered to be obese. So the question then becomes, well, is this all related to diet and exercise? As it turns out from this study in 2016, it may not all be related to diet and exercise. So there's this study from 1971 to 2008, and it's data from the National Health and Nutrition Survey, which studied 36,000 US adults, more than 36,000 US adults. And what they found is that factors other than diet and physical activity may be contributing to the increase in BMI over time. Now, as you may recall, I did a talk last year on intermittent fasting, and what we talked about there was that Americans are eating more frequently, so up to even 10 meals a day, small meals a day. So remember that unlike what I learned in medical school, which is that a calorie is a calorie, you can actually have more of an insulin effect if you have a calorie at night versus during the day. So that may be one piece to consider. But in addition, this is another aspect that we're going to talk about now. So this is an overview of chemical use. The EPA has listed that there's about 87,000 chemicals in use currently. Pesticides, in 2003, there were 21,000 pesticide products that were listed by the EPA, and herbicides are the most common type of pesticide. So we always think about pesticides as being applied on farmland, but that's actually not the case. So it also includes our homes, railways, golf courses are tremendous users of pesticide products, government lands, forests, airports, also big users, roads, and municipal lands. So 60% of herbicides that are used are actually documented endocrine disruptors. What an endocrine disruptor is, briefly, is that it disrupts our natural hormones, and we'll go into that in a little more detail later. Plastics, according to this study in 2004 that I listed here, developing countries' plastic production is increasing at about 40% per year. And in the US, plastic production in 1996 was 85 billion pounds per year, which is more than 330 pounds per person per year. And one important thing to keep in mind through this whole talk is that a number of different environmental toxicants can cause basically prenatal and fetal effects. So it can take generations to see those effects. This is another slide about plastic production in million tons per year globally. So we can see that in 1970, we had less than 100 million tons of plastic production per year. Currently, in 2023, we're at about 400 million tons of global plastic production per year. And you can see that more than half of all the plastics that have been produced have been made since the year 2000. So the forecast is that we are at 1,400 million tons of plastic per year by the year 2050. So these are some definitions. So what's an endocrine disruptor? An endocrine disruptor is a chemical compound that interferes with normal endocrine function. Unlike many toxins, it can act at low concentration and it mimics the action of hormones. So things like thyroid hormone, reproductive hormones, cortisol, adipokines, insulin, etc. It may not be as specific as those hormones. In fact, it usually isn't and can act on multiple pathways at once. Currently, there's about 1,000 endocrine disruptors that are documented. In scientific research, an obesogen is a term that refers to a chemical that disrupts metabolic processes that contribute to obesity and adipogenesis, meaning fat generation. It's often categorized as a form of endocrine disruptor, although the mechanism is not necessarily limited to being an endocrine disruptor. So let's look at obesogen's mechanism of action in a little more detail. So, and I listed, by the way, this study by Heindel, which is a 3-part review, is fabulous. It's very, very, very detailed. So if you're ever interested in reading more about obesogens, I highly recommend it. In terms of the mechanism of action, the obesogens increase the number and size of fat cells, increase storage of fat per cell, increase appetite, can affect satiety and food preferences, alter our basic metabolic rate, alter insulin sensitivity, and mimic or alter hormones, as I just shared, just like any endocrine disruptor. And the insulin sensitivity effect can be on multiple tissues. So I listed some of those tissues there. So now, clinically speaking, we're going to look at a landmark report that was published by 2 governmental agencies in collaboration with each other, the Environmental Protection Agency, as well as the National Institute of Environmental Health Sciences. So this collaboration this report was the result of 17 years of research from major medical centers, and then they collated this information into this landmark report. So we'll go in through this report in some detail now. So as I shared, this report is actually 17 years of scientific data. These government agencies basically gave $300 million in grants to major medical centers. So Columbia, Duke, University of Washington, University of Michigan, USC, many, many, many different medical centers over 17 years. So this is an overview of what they found. They found that, for example, phthalates, which are found in plastics, decreased fetal growth, which is an important predictor of adult health, caused neurocognitive delay in children, caused adverse behavioral and cognitive outcomes in children, and were obesogens. In addition, flame retardants, which one type of flame retardant is called polybrominated diphenyl ethers, or PDBEs for short. And this, just by the way, is found in about 100, well, in scientific studies, it's found in 100% of house dust samples throughout the United States. And I put this picture here, you can see this picture because PDBEs are found in a lot of textiles. So you can see on the headboard here, it'll be in all the fabrics, often in the mattress, the lampshade, even in our building materials. So it's not limited to textiles. So it's very pervasive, which is why it's in 100% of house dust samples. So these compounds, PDBEs, actually decrease birth weight, contributed to childhood leukemia, and caused adverse behavioral and cognitive outcomes in children. Polycyclic aromatic hydrocarbons are basically a compound that's generated anytime that something burns inefficiently. So it could be blackened chicken at the, that you bought at the restaurant, or it could be from exhaust. In the point of this talk today, we're going to really focus on the exhaust side. So near anybody living near a road or in a city like we are. These have negative impact on cognition and behavior in children. They contribute to childhood leukemia, and they've been found to be obesogens based on this landmark report. Chlorpyrifos is basically a type of organophosphate pesticide. And organophosphate pesticides are about 50% of the pesticides that in the US we spray on things. It was a very common, actually one of the most common pesticides in agriculture in the US up until just 2001. So it was, and it's still sort of getting phased out now. It has been known, it was actually, and like many organophosphate pesticides, what happened is in World War II, they used them as toxic nerve agents. And then after the war ended, they needed a place to divert those to. So they put them into agriculture as a pesticide. So many organophosphate pesticides have this effect, but this is one of them that was used as a toxic nerve agent. And it's been shown for many years to be a problem for children in terms of cognitive and behavioral outcomes. But it took 32 years of advocacy to ban it on food. It's still used in golf courses. As I mentioned, golf courses are a big source of pesticide exposure. Cow ear tags, so they're, for insects, wood products, and factories. Okay, this is another summary statement from this landmark report. So pesticides, phthalates, and polycyclic aromatic hydrocarbons, like I said, that's from exhaust, bisphenol A, and polybrominated diphenyl ethers, again, that's from textiles or building materials in houses, have shown a relationship to adverse cognitive and behavioral outcomes, demonstrating links to ADHD, reduced IQ, lessened self-regulatory capacities, anxiety, depression, attention problems, lower memory function, and structural changes to the brain in children. This is another summary statement from this report. Exposure to PCBs, PDBEs, and PAHs are potential new risk factors for childhood leukemia. So again, as a reminder, PBDEs are flame retardants found in house dust in our houses. PAHs are related to exhaust. PCBs are known as polychlorinated biphenyls. And basically what they are is they're termed a persistent organic pollutant. So they were banned a while ago, but the problem with these chemicals is that they persist in the environment because they're really hard to break down. And so you find them in high amounts in dairy, meat, and also in fish is one of the highest sources of PCBs. 2/3, so farmed salmon is a very high source, as are sardines. I just want to point out that 2/3 of the salmon in the United States is actually farmed. And there's an issue with labeling fish. So there's been a study by an Oceana report showing that 43% of fish is actually mislabeled, not only in the US, but globally. But US is actually a big source of mislabeling. And one of the most common errors in mislabeling, if not the most common error, is labeling farmed fish as wild. So if you go to a restaurant and you think you're getting wild Alaskan salmon, or you go to a grocery store and think you're getting wild Alaskan salmon, it may not be wild, it may be farmed. So keep in mind that that's a high exposure to PCBs. Okay, so this is again just taking extracts from the same report. We can see that the role of environmental factors in autism is greater than previously thought, maybe related partly to environmental toxicants, and that our rates of childhood leukemia have gone up 35% in the past 40 years. So now we're going to focus down on this report in terms of obesity and reproductive development. And I circled both of those because they kind of go together because they're both endocrine, they're often an endocrine disruptor mechanism. Okay, so obesity. So you may be wondering, okay, well, we're focusing a lot here on children. How does that affect adults? I just want to remind us all that children and teens who are obese are 5 times more likely to be obese in adulthood. So this actually affects our adults as well. So continuing with this report, what they found is bisphenol A and phthalates can interfere with the body's natural hormones. and contribute to obesity and type 2 diabetes mellitus. In addition, here we're starting to see prenatal effects. So prenatal exposure to these compounds actually was associated with insulin resistance in children 8 to 14. So a decade later, from the prenatal exposure, we're seeing an increase in insulin resistance. This is a study from the University of Southern California showing that air pollution contributes to obesity, is related to body mass index in children. And again, we're seeing this prenatal effect. So prenatal exposure to polyaromatic hydrocarbons, remember that's an exhaust, incompletely burned fuels of any sort, were associated with an increase in BMI in children. So again, prenatal exposure leading to an increased BMI much later in children. This looks at prenatal exposure to BPA, so bisphenol A, was associated with an increase in fat mass, body fat, and waist circumference in children. So again, we're seeing a prenatal exposure affecting children later on. And what they point out here is that our traditional risk factors, so we often look at BMI for obesity, as you know, but that our traditional risk factors may not be sufficient for children's health because the BPA actually affect fat mass index, body fat, and waist circumference rather than BMI in this study. Although in other studies, it has affected BMI. So in summary, this governmental organization collaboration found that prenatal and early child exposure to BPA, phthalates, air pollution, and secondhand smoke contributes to obesity in childhood that persists into adulthood. So now I want to point out that standard medical thinking, which is usually we're talking about, and I've even presented on double-blind randomized control trials, right? So one drug at a time, we're checking in a double-blind randomized control trial to try to isolate the effects of that medication or that toxicant in this case. The issue is that that doesn't really assess biologic impact of many exposures, possibly of small or large concentration over years. So let me give you just a practical example. If we have a child, they're living in a house, they can be, again, 100% house dust samples have BDEs, those flame retardants. Then let's say they're eating out of plastic packaged foods. They're going to get exposed to phthalates, possibly BPA, depending on what's around them. And then they go out, they're living near a roadway or in a city, and they're getting exposed to PAHs. And that can go on for much of their life. So we're this thought that we have to isolate it and just do one thing at a time is actually false, and it's inaccurate in terms of the effects on human health. So to that point, I just want to go through a couple of studies. This one is from 2019, and what they did is they sampled plastic packaging. So what they found is that plastic packaging can have up to 4,000 chemicals in it. And 34 of the chemicals that they sampled in the plastic packaging were listed as endocrine disruptors by the United Nations. In addition, 7 were listed as persistent, bioaccumulative, and toxic, and 65 were listed as hazardous for human and environmental health. So again, if we have a child or even an adult eating out of plastic, there are many, many foods now are in plastic packages, they're getting exposed to potentially many of these compounds all at once. And we really don't, our standard medical thinking of double-blind randomized control trial for one thing at a time is really not going to pick that up or do it justice in terms of human health. Here's another study from 2022, which I found very interesting. So in this, they took yogurt containers, freezer bags, vegetable trays, and scouring pads, and they basically did something called non-target high-resolution mass spectrometry on these products. And it's a way of sort of seeing what chemicals are in there because a lot of them are non-disclosed. What they found is that there were over 55,000 chemicals in those products. Only 629 of them were listed in databases. They couldn't even identify most of them through a database. So again, when these chemicals get together, we don't again know what the full ramification of that on human health is. And what they did as a result, because they couldn't identify most of the chemicals, is they did extracts. Basically, they'd take an extract from the yogurt container, an extract from the freezer bag, et cetera. And they found for 34 of the products that these were obesogens. So the extract, which again is looking at multiple chemicals at once, was an obesogen. Okay, that all being said, let's look now. We've just talked about that synergistic effect, but I would like to spend some time now talking about specific chemicals so we have a little bit more detail on that. Okay, bisphenol A, many people are familiar with. It's gotten a lot of media attention. So bisphenol A, or BPA for short, is one of the highest volume chemicals produced worldwide. So 6 billion pounds are produced each year, and the CDC has found that 93% of Americans have BPA in their urine. It's a starting point for plastics, and it makes them clear and tough. So when you put plastic in a microwave, it's much more likely to leach BPA into the food, as is if you have it in an acidic environment. So for example, cans with tomatoes, those are going to leach way more BPA because you've got an acidic medium there. The FDA's official position on BPA is that it's safe. It has been banned in baby bottles and infant formulas. The safety level that we set in the United States, you can see here, is 50 micrograms per kilogram per day. The EU sets their safety up until this year to 4 micrograms per kilogram per day. And as of April of 2023, so just recently, the EU has lowered it, you can see 0.2 nanograms per kilogram per day. So much, much lower. And the reason for that is because BPA, like many endocrine disruptors, can have health effects, negative health effects at very low concentrations, as we would expect for something that's acting like a pseudo hormone. The Endocrine Society 2015 statement supports this. So fact that negative effects are presumed below even what's set as the US safe dose. So where is BPA found? This makes me laugh every time I see it because, so I have a board degree in internal medicine, but also in integrative medicine. For my integrative medicine boards, we get lots of tests on, chemical toxins and where they're found. And one of them was, listing all these products and where, which one is the highest in BPA. And it's receipts, actually. Receipts are surprisingly high in BPA. And when you wet your fingers or get grease on it, a lot more goes. It can actually be easily transmitted through the skin. So anyway, so receipts are one because of the thermal effect in going through the machine. So where's BPA found? BPA is found in soda cans. So anybody who's drinking soda, that'll be a source of BPA. Any kind of can, basically, for the most part. Coffee makers, this is the one that my kids were shocked by, but actually I was like, that coffee maker is full of BPA. Because think about all the plastic parts that the coffee is going through, right? So, and in fact, it leaches not only BPA, but phthalates into the coffee. Dental sealants, and then feminine hygiene products, which a lot of people don't think about. So those are sources of BPA. Now, what I want to point out from these 3 studies is that 90% of the BPA in the US we get exposed to is actually from what we ingest, both beverages and foods. So you can make a big impact on your BPA exposure and those of your children and family through paying attention to what you ingest. So what are the mechanisms of action of BPA? It binds to the estrogen receptor, and this is very, very well established, reduces efficacy of androgens, antagonizes thyroid hormone. It affects fat cell generation and differentiation, and it affects beta cells. So of course, those are in our pancreas, and that's why BPA can be linked to diabetes. And it also increased breast cancer risk in animals. You'll notice here again, we have a prenatal effect, or a fetal effect. So you'll see in animals, the increase in breast cancer risk, it starts with gestational exposure. So when the baby's in the womb. BPA is very challenging to study, as I've shared, many environmental toxicants are, because most of the negative impact is actually in prenatal and fetal development. So you may not see effects until decades later. The one study that I was looking at, they even had transgenerational effects. So there's an increase in polycystic ovarian type symptoms in animals who are exposed to BPA in this generation, and even at 1 or 2 generations down, they can have an increased risk of polycystic ovarian syndrome type symptoms. So studies that were just looking in adults in a double-blind randomized control trial for a couple of years is not going to capture this. Okay, I know in that landmark report we talked about BPA contributing to obesity, but I just again wanted to pull out some studies and give you some data here. So what it shows here is that a higher urine BPA level of greater than 2 micrograms per liter had a 2-fold increase of weight greater than the 90th percentile among girls ages 9 to 12. And this, you may think, okay, what is 2 micrograms per liter a lot? You can see it corresponds to the median urine BPA level in the US population. So we're not way outside the norm here. It corresponds to the median. In addition, this is a prospective study of 888 Chinese adults, and they actually started with normal weight. And then basically they checked their urine BPA levels at baseline, and each unit log increase in urine BPA, so on that initial baseline, predicted a 2.3 increase in central obesity at 4 years later. So we all know that central obesity can even be worse than we think about apple and pear, right? So that apple type obesity is really associated with a lot more negative health effects because of its effect on inflammation, and many other things, fatty liver disease, heart disease, et cetera. So central obesity can be more detrimental even than pear-shaped obesity. So a few more studies on obesity and BPA. This study in JAMA correlated obesity with levels of BPA, so higher levels of BPA, more obesity. This study from BMJ, which was a meta-analysis of 17 studies with over 32,000 patients. And they actually, in this study, looked at a lot of different chemicals. So that was interesting to me. But basically what they found is BPA and phthalates were consistently associated with obesity and increased waist circumference in adults. In addition, BPA may be an independent risk factor for the development of diabetes and prediabetes. So again, we're used to, and I was taught in medicine, that diabetes is related to, just not exercising, how we're eating, but BPA may actually be one of those risk factors, independent risk factors. And in heart disease also. So we see this study from Circulation in 2012. It was found to be an independent risk factor for heart disease, which I find interesting. So then I get a lot of questions about this from patients, which is BPA-free. Is something BPA-free better? Even in the natural medicine community, a lot of people don't know this, but BPA-free products tend to have either bisphenol S or bisphenol F. So BPS and BPF. Animal studies at this point suggest that they have similar endocrine disrupting effects. So they are estrogenic at the same order of magnitude as BPA is. So BPS is in your makeup, paper towels, lotions, hair products, etc. And you can see in this study in 2020, it had similar or worse obesity effect that BPA did. So both BPS and BPF in animal studies may be similar to BPA, but at this point, we don't have enough human studies to verify that or to know that for sure. Okay, so now we're going to move on to a different chemical, which is phthalates. So phthalates are a group of chemicals, actually. So BPA is kind of one chemical that is in plastics. Now, phthalates are a bunch of chemicals that are found in plastics. So there's about 25 of them, and we divide them into high molecular weight and low molecular weight. Okay, so high molecular weight they're basically called plasticizers, simply put. Plasticizers make plastics flexible, they last longer, and they're more transparent. Low molecular weight phthalates are basically solvents that you find in your shampoo, conditioner, lotions, makeup, all of that. So plasticizers are your high molecular weight. Low molecular weight are found in health and beauty aids as solvents. Okay, so those are the two main places we're going to find phthalates. And those plasticizers can be in all kinds of things, on fabrics, building materials, etc. So phthalates are ubiquitous in the population, and they migrate very easily. So this is an example. I read a study where they basically were looking at tortilla package, so you've got tortillas in a plastic bag, right, with print, like whatever the label is on the front. Well, that ink is actually has phthalates in it. And so because the phthalates don't bind to the plastic, that's what makes them flexible, right? They migrate. So they migrate, those phthalates were found in the tortillas, like a couple tortillas down, because they migrate so easily. And if you microwave or you're adding heat, you're going to increase that migration. So remember that BPA and phthalates are found frequently together in products. So plastic packaged foods, again, your coffee maker, they often are found together. In animals, the effects of phthalates begin in utero. They block insulin, thyroid, androgens, and ultraprogesterone. And they have been shown to decrease mitochondrial oxidation of free fatty acids by 50 to 60%. So with environmental toxicants, you could go, probably do a one-day CME on it. But basically, many environmental toxicants suppress mitochondrial function. And that can be one of the reasons why, for example, many environmental toxicants that we learn in integrative medicine are related to decreased cognitive function, because the brain uses so much energy in mitochondria, chronic fatigue. And here also they point out that drop in mitochondrial function can explain part of the reason for obesity and as well as infertility. And here they list infertility in men in this particular study. Actually, there's 4 studies here that I list. Okay, so where are phthalates found? Phthalates found are in health and beauty aids. So your shampoo, your conditioner, your shared hair gel, makeups, anything with the word fragrance in it can have phthalates in it. So air fresheners, anything with the word fragrance. A lot of building materials. So here I put an example of vinyl flooring. PVC piping, I've noticed that now a lot of pipes, we're substituting out our type of pipes into PVC piping, plastic-based piping. That'll have a lot of phthalates in the water as a result. Mattresses, a lot of textiles. And then from a medical standpoint, you may be interested to know that IV bags, IV tubing, a lot of medical devices have phthalates on them. And the coating on medications, we often add phthalates to that. In this hamburger bun, what we see here is that sandwich wrapper. That'll have phthalates usually in it. So the wrapping of the hamburger, and see the sauce, again, that's in a plastic container, that's going to have phthalates. And remember that it'll also be in the food, because so certain phthalates can actually, again, migrate into the food. To-go containers, so all to-go containers often have phthalates, but pizza boxes are one example, so I just put that there. Plastic Tupperware, so any kind of plastic Tupperware, and drinking straws, things like that. Okay, what are the clinical effects of phthalates? Phthalates in this prospective study funded by the NIH was found to increase the risk in Caucasian women of diabetes, developing diabetes, by 30 to 63%. For obesity, numerous studies have linked phthalates to obesity. So I've already cited a number of them. We talked about that landmark report under the BPA section. I talked about another study there. And here's a couple more studies from 2007 and 2015, looking at US adult women, US adult men, and basically that increasing level of phthalates correlated with more waist circumference, more insulin resistance, and a higher BMI. It's also, as I've just shared, been linked to infertility in both men and women. So as this study points out, a 20% reduction in male fertility with low molecular weight phthalates. Again, low molecular weight phthalates are the ones that are found in your health and beauty aids, makeup, etc., hair gels, and sunblock. Endometriosis and uterine fibroids. So because they can affect progesterone, this is another issue. And then neurodevelopment. Recall that in that landmark report, phthalates were associated with adverse neurodevelopment in children. This is one more study I placed here from 2009. And in this study, they found an association between vinyl flooring and increased risk of ASD, so autism spectrum disorder. Okay, so now moving to another section, which is pesticides, because we said we talk about plastics and pesticides. So glyphosate. Glyphosate was initially discovered in 1970 by a Monsanto chemist, and it is an herbicide that was so strong that it was unable to be used for the most part, except for under power lines and railways, because it killed everything. And now it's the most widely used agricultural chemical or pesticide in the world and in the US. Part of the reason for that is because we created genetically engineered crops that are so-called Roundup ready. That's one of the lay language for them. But these include corn, cotton, soy, alfalfa, and sugar beets are so-called Roundup ready, meaning they are genetically engineered to be resistant to this pesticide. Wheat is not genetically engineered yet, but what people often don't realize is they spray a lot of glyphosate on it at the end of its, towards the end of the life, when they're harvesting it as a desiccant, meaning to dry out the wheat so that it can go through the machinery. Legumes, the same thing. They do that as a desiccant. So you get a lot of glyphosate exposure even on wheat, even though it's not genetically engineered yet. They are now creating crops that are resistant to multiple herbicides. So for example, the US government approved genetically engineered soy and corn, and that's resistant to glyphosate and 2,4-D. We're not going to talk about 2,4-D that much, but basically just simply put, the International Agency of Research on Cancer, which is a subsidiary of the World Health Organization. They're a subsidiary of that. They've listed 2,4-D as a possible carcinogen. So glyphosate affects the shikimate acid pathway. So remember, I did a talk last year on the gut microbiome, and one of the arguments has been that, okay, glyphosate doesn't affect a human pathway, so it shouldn't affect human health. But in fact, as we talked about in that talk on the gut microbiome is instrumental for human health, as it is for many, many mammals and insects. So when the shikimate acid pathway is used by microbes. And so when we're affecting microbes in our guts, that actually can potentially affect human health. Let's look at glyphosate use in the US between 1974 to 2014. We started at, this is in pounds per year applied. We can see in the 1970s, we were about 140,000 pounds per year applied. And well, in 2014, so this is about 9 years ago, we're at 277 million pounds per year applied. So what we see here is that increase in the curve where you see that exponential growth. In 1996 is when genetically engineered crops came on the market. So they're so-called Roundup ready. And we see an exponential increase in use of glyphosate at that point. So interestingly in this study, and I didn't put it in, but it actually parallels a rise in drug-resistant weeds. So it's similar to antibiotics, right? If we use a lot of a certain antibiotic, we're going to get more drug resistance, which then has been the argument for why we need, even more engineered seeds, because now they're adding 2 pesticides so that more of that can be addressed in terms of spraying. So regardless, between 1974 to 2014, over 3 billion pounds of glyphosate active ingredient has been sprayed in the US. Okay, glyphosate is listed by the International Agency of Research on Cancer. Again, that's a subsidiary of the World Health Organization as a class 2A carcinogen. This is an agency that in this particular case, they had scientific experts from 11 different countries that met to review scientific literature and data on glyphosate. And this is what they came up with, is that it's probably carcinogenic to humans. The EU is in the midst of trying to ban glyphosate right now. It's difficult to study glyphosate. And pesticides are basically commercial mixtures. So studies tend to focus on glyphosate by itself, but in reality, glyphosate, when I looked at it, from my understanding, there's 750 different glyphosate-based formulations on the market. So glyphosate doesn't come by itself. It comes as a mixture. And there currently, like I said, there's about 750 mixtures approved for use. One of the main criticisms of current regulatory pesticide approval processes is that in the US, is that they do not require safety testing of the mixture or the formulation. So the reason is that many studies and scientists assume that the only toxin in the product is the active ingredient. So the only toxin is glyphosate, so that's all we need to study. But what's been shown, and I put 2 studies here to elucidate this, is that, for example, Roundup. Roundup's the name of one glyphosate-based formulation or mixture. Roundup is 1,000 times more toxic to human cells and animals than glyphosate by itself. So even though we're only required in the US to study glyphosate by itself, in fact, the mixture in these studies was 1,000 times more toxic. So we're not capturing that in our studies. Glyphosate is an endocrine disruptor, meaning it affects estrogen, thyroid, steroid metabolism, and protein synthesis. It's an anti-androgen. It inhibits mitochondria, as I shared, a lot of environmental toxins do. It creates DNA damage, and it's cytotoxic. And I listed the studies here for support of that. This is another point about mixtures. So POEA is the name of the surfactant. That surfactant is found in a lot of these glyphosate-based formulations or mixtures that we find over the counter or in herbicide mixtures. In this study here in 2016, it was 1,200 to 2,000 times more cytotoxic than glyphosate by itself. But because by federal law in the United States, it's labeled, this surfactant, even though it was more cytotoxic, it's labeled as inert, and it's allowed to be labeled as inert because it's not actively targeting the pest. So something that's not actively targeting the pest is considered inert. Or remember that formulations can also have proprietary ingredients that they don't even disclose. So we don't actually know all of what's in a formulation. For obesity, this is really tough to study. Mostly in animals, what they've seen is obesity happens 2 to 3 generations later. So with glyphosate, so it'd be really hard to study that. There have been associations of glyphosate with renal failure and toxicity. So in Sri Lanka, for example, there was an epidemic of chronic kidney disease with rice paddy farmers using glyphosate. So those spraying the glyphosate had 5.4 times the increase in kidney disease. And in China and Latin America, they found this as well. So, but in terms of obesity, the data is not as clear. Okay, so what can we do? All right, so this is a question I get a lot from patients, which is, does organic food actually decrease my glyphosate exposure? Turns out, at least based on this study, it does. So in 2020, what they did is they took racially and geographically diverse US families, and they basically ate organic for about 5 days. Well, not about 5 days, 4 or 5 days. And what they found is that with eating organic for 5 days, their urine glyphosate dropped by 70%, and their AMP levels dropped by 76%. Recall, as I've shared with you, between 1970 and 2014, urine glyphosate levels in the US population increased by 600%. So in our urine, a 600% increase in 70% of the US population. So this is actually clinically relevant to see this drop in urine glyphosate levels. So another question I get a lot from patients is organic food really organic? So in this study in 2020, it looks like organic food does have lower pesticide residues. These researchers analyzed data from 3 different testing programs. So the pesticide data program, which is basically the USDA, the US government, the California Department of Pesticide Regulation, so the Californian government, as well as private tests by Consumers Union, which is an independent testing organization. So they looked at data from all 3 of these database sets. And they found that organic food had consistently 1/3 the pesticide residues of conventional. Okay, more points on organic. The Annals of Internal Medicine in 2012 did a review of 240 studies, and organic food reduces exposure to pesticide residues. In the British Journal of Nutrition in 2014, it was a meta-analysis of 343 studies, and pesticides residues were 4 times higher in conventional versus organic. So again, just pointing out that there seems to be, based on data, lower pesticide residues in organic food. Now, these next 4 studies that I list here on the slide are basically what they did in each of these studies is they had people eat organic for a period of time, and then they would measure their urines pre and post. So you can see here that with eating organic, we see a large drop in urine levels of organophosphate pesticides in children, 2,4-D herbicides in children, chlorpyrifos in children, and multiple, in this last study, multiple pesticides and herbicides dropped, including glyphosate, with eating organic for 18 days. In addition, organic food may be higher in nutritional value. So there's higher omega-3 fat based on, and I listed 6 studies here, but there's actually a lot more. Just don't have room to list every single one. But basically, there's higher omega-3 fat in organic food, in the dairy, higher polyphenols and carotenoids in the fruits and vegetables, and also not just magnesium, but other minerals can tend to be higher in organic food. This study was a very interesting study to me that was done in San Francisco, and they took 20 families. Each family had 4 members in it. And basically what they did is they had people eat organic fresh food for 3 days, and they did not use plastic utensils. They did not use non-stick coated hard cookware, no cans. They stored their food in glass containers with a plastic lid, but they made sure that the food wasn't touching the plastic lid. So it had to be less than full. And then the coffee that they drank, they made sure that the coffee was in French press or using ceramic drip. So no coffee maker or going to the cafe for the coffee. And what they found is a reduced urine BPA by 66%, as well as DEHP as a phthalate metabolite by 53 to 56%. So in 3 days, which is pretty remarkable, actually. So in summary, plastic products, so BPA and phthalates are endocrine disruptors. They are probable obesogens. BPA-free products like often include BPS and BPF, may equally be endocrine disruptors, but we need more studies in humans. Glyphosate is an endocrine disruptor, but it's not clear if it's an obesogen. The studies have really been for animals and they're transgenerational. It is listed as a class 2A carcinogen by the International Agency of Research on Cancer, which is a subsidiary of the World Health Organization. It may be associated with renal failure and renal toxicity. Mixtures of glyphosate, so combinations, may increase toxicity, but we're not required to study those mixtures in the United States. All these products, many environmental toxicants, are really difficult to study because they can have prenatal, fetal, and transgenerational effects. So you may not see the effects for decades. You can influence exposure for you and your family with watching what your food and beverage intake is and how you prepare and store your food and beverages. And I just want to add one last point. As I shared, I have this degree in integrative medicine and functional medicine. In that world, we actually talk a lot about also what you can do to detoxify the body, so support detoxification of these chemicals from the body. But that's a very long and complex topic, but I do want to mention that because, and that doesn't mean, by the way, chelation. Chelation can be very dangerous, but there's more natural supportive ways that are just natural to the body that you can do to also detoxify beyond what we've listed here. So thank you very much for your time.
Thank you, Astrid. I Appreciate the time. There was a question about Roundup halfway through, but then you got to that part of the talk. I have to tell you, I stopped drinking my coffee halfway through this, and I'm glad I ate breakfast before I got here, because I don't know what I'm going to eat for the rest of the day. And even if I go, I'm going to pick up the labels and look at them. I'm going to get stuff all over my fingers, and then I'm going to go check out, and the receipt's going to kill me, except at PCC. Somebody says, how do you deal with this sort of, yeah, how do you deal with the, I mean, it seems like at this point, the snowball has gained momentum. It's halfway down the hill, and it just doesn't seem practical to stand in the way of that. How do we address this and not have just this fatalistic, there's nothing I can do. I can eat organic, but even if I eat organic, I'm gonna wash it in water that has toxins in it. How do you deal with that? Just that mindset of, gosh, we're doomed.
Well, to be honest with you, I was so grateful to all of you and excited to speak to you today. And I told my friend and my sons, actually, first of all, my sons, I just have to tell you, Bruce, that my son, like, I went through this lecture. He's in the UW doing engineering, so he gets exposed to all this. And which we all do, actually, so it doesn't matter. But he's like, Mom, you have to put some positive things at the end because you can't just leave people like that. I'm like, okay, good point. So I made sure that the end was the, how you can detox. But why I was so grateful and excited to speak to all of you is because actually all of you are educated, thoughtful people. And it's not one person at a time that we can change this, but we can advocate for a different world for our children and for our grandchildren. We can. And I think, this is not a political, but politics is part of it. How we eat, actually, for me, even when I educate patients on this, I feel like, actually consumer demand for organics has been influencing farming, and it influences politics. So we have the ability actually to be politically active through what we choose and where we spend our money and where we vote. So I want to share with all of you, you're all influential people, and also sharing this with your patients. That's why I'm so grateful to be able to do this talk, sharing this information with your patients, even a simple thing that it's organic is not, it has data behind it. It's not just, something, there's data to support it. So I just want you to remember, and us all to remember, our power as consumers, as educators. You are leaders as providers. So I was so excited about that. And also, educating our young engineers, educating our children about this and our grandchildren, so that they know that we all together, we can make a difference, even if individually we feel like we can't. So that's how I view it. I view it more as, how can I educate? And to me, education changes the world. And all of us as providers are educators, all of us, because we're all educating patients all day long, right? So that's how I see it.
Astrid,
I see a lot of questions about detox here.
Yeah, exactly. Is there any place that you can direct people to begin their own education on this?
Yes. Okay, I'm all for it. So the thing I always tell patients, there's a website that actually, so some of you may have heard this term, the Dirty Dozen, which a lot of my patients have heard. Dirty Dozen actually was invented by a nonprofit organization called the Environmental Working Group, EWG.org. And they're a great place for education. They'll help you with your health and beauty aids. They'll help you with your fish consumption. They do a lot of advocacy. So in another place that I like that's a little more science-based, Environmental Working Group is science-based, but there's also the NRDC, and I think it stands for National Research and Defense Council. It's a group of scientists and lawyers that are advocating politically and basically with lawsuits. A lot. I think they're their acronym is the Earth Needs a Good Lawyer or something like that. But regardless, these are two places that have information, but the Environmental Working Group's a popular one with patients because it'll list like, what are the top 3 places that you can, avoid this chemical or that chemical. In terms of detoxification, I'm going to give you one simple trick. I know we talked in the gut microbiome talk about fiber and that indigenous populations, our fiber goals in the US are set at 30 grams per day. And we talked in the gut microbiome talk about how the gut microbiome is really important for detoxification, but it's also, our fiber goal is probably set too low, as you may recall. So in that, what we talked about is our fiber goal probably should be around 60 to 100, which is what we're seeing, let's say, in rural South Africa or other indigenous populations, Tanzania, on their traditional diet. That, interestingly, when you just increase fiber, what you do is the liver has, as you may recall from medicine, we've got about 5 different metabolic pathways for detoxification of chemicals. Then the liver dumps all that into the intestine. If you don't have enough fiber in your intestine, you'll have enterohepatic recirculation, so it'll come right back into the body. So having enough fiber is one simple trick that you can do to improve detoxification. And that you could do over time. Now, remember, the fiber needs to be ideally more soluble, because soluble will bind, but it also feeds the gut microbiome, which will then help your detoxification. So that's just one simple trick. And then, like I said, I think those 2 websites might be helpful for education.
There's a lot of comments, but here's another question. In contributing to obesity, how do you separate the effects of the plastics themselves from the effects of highly processed foods, which are frequently packaged in plastics?
Yeah, I actually didn't put this in to the talk, but actually they did even a study on organic food. I'm not a fan of processed food anyway, because anything in plastics, you're getting, like you said, whoever this provider is, I agree with you wholeheartedly. Organic food will have less additives and sort of substances in the packaged food that then contributes to caloric density, and that caloric density then contributes to obesity. So what they did in the studies is, you saw, like, one of them, they're actually using extracts from the plastics to look at the effects of plastics on then whether they transform in vitro or in animals, the work as obesogens. But again, it is hard to separate out because we're getting exposed to all of it at once. So really, it's kind of almost a different philosophy than we're used to thinking in medicine. We're used to reductionist thinking in medicine, and this is truly holistic thinking, where rather than saying you're really just switching over to fresh food rather than packaged food. And that will eliminate a lot. And that's different than we're used to in medicine thinking in a reductionist model, but this is sort of pointing out some of the issues around the reductionist model as a whole, which in integrated medicine, functional medicine, we care a lot about, like, how do we switch to more of a holistic view too, and not just reductionist model.
I'll add to that. My breakfast, I did have organic wheat cereal, but then I looked and it's packaged in that waxy paper that's got PFAS and all sorts of things. It's kind of interesting. It seems like there should be more consistency across. It's probably commercially driven, and they probably are. It's really more about the money than making us all healthy in that situation. But it seems odd that they'll cue into the organic part, but then not cue into the packaging part. And I think what you just said, probably the best is just fresh food that isn't packaged at all, and you pick up off although the wood products have stuff in it, if it's sitting on a wood table, you're in trouble. I may just fast.
But still, fresh food. That's why fresh food is still better. It'll help on a lot of levels. Not only for yourself though. You're actually making an impact for others. So that's the thing. It does influence your community too.
So lots of thank yous and great informations. And there's, oh, here's a new one. Let me just see what's going on. Oh, yeah, I'm with you. I mean, James Rice says, well, I'm glad my daughter didn't attend this lecture. She would not ever eat again. It's a little bit genderized, but I got to tell you, I'm not going to eat either. So it's not just gender related.
We can go back to the intermittent fasting talk.
Yeah, that's going to be easier for me to think about now.
Actually, fasting, I'll just add, I saw a lot of questions on detox here. Fasting actually is another mechanism that'll help, because remember, with fasting, you have, when you eat, you're doing, growth of tissues. During fasting, you're actually doing naturally, the body's naturally doing detoxification. That's just part of what happens in repair. So fasting is another mechanism that in many traditions has been used, but actually helps. Not continuous fasting, which would be starvation, but periodic.
Great. Well, thank you, Dr. Pujari. We appreciate it always. Look forward to the next talk. Let me know when you're ready. Thanks, everybody.
Thank you.